Hello, good evening, everyone. Welcome to the Health Seniors Human Services Youth Education and Human Rights Committee meeting. This is the monthly meeting. My name is May Lee and I am the chair. Before we start the meeting though, just for the record, Larissa will explain the procedures of how the Zoom meeting is run.
Okay, good evening, everyone, and welcome. Tonight's meeting is being recorded for your information. We ask that everyone please remain muted during the meeting unless you're acknowledged to speak by our chair. Our questions mostly will come from our chair. For our committee members, you can raise your hand to ask a question. Sorry, I don't have the form up in front of me. May, I apologize.
Yeah, you can raise your hand to ask a question. Yep. I'll acknowledge you. Right now I see mainly committee members here, but generally the procedure is that committee members can speak first, or I call on them first if they raise their hand. And then I do rotate to others who are not on the committee.
Correct. If you're so if you are not on the committee, she will, if there is time, she will allow you to ask your question.
Okay. Thomas, our secretary, is out today. And so Larissa will take over his duties and do the roll call.
Okay, Maylee.
Here.
Thomas Rosa is absent. Larissa present. Ana Calderon.
Here.
Thank you. David Crane.
He's out.
Okay, thank you. Eric Diaz. I didn't see Eric. Did he pop in? Okay. Larry Finn.
Here.
Thank you. Shirley Fennessy. Deborah Glass.
Sorry, present.
Thank you. Alicia Lewis Coleman.
Here.
Laura Lugo. Laura, I think, is absent. Heidi Schmidt.
Here.
Arnett Scott.
Here.
And Carmen Perez. Okay, thank you, May.
Okay, so I know we have new members here today, but this is also to approve the minutes. If you were here last month and you have any changes to the minutes, please speak up. If you don't, they are deemed approved. So for those of you who are not here, this, and this is your first meeting, you don't have to approve the minutes. The purpose of this roll call is more to take attendance. So we will take attendance once in the beginning and once at the end. First and final. So so the agenda is in front of you. This agenda is published every month, and I also email it out. It's on the website, and today's agenda is rather short. Many times we have many different items and to discuss, but today our main agenda item will be the discussion of the district needs statement. It will be followed by a report of any CB3 has membership or is represented on various community advisory boards, such as the hospitals or nonprofits or shelters. And we're also go to the Community Education Council meetings. So if any of, and we are, officially appointed to be a CB3 rep, somebody is officially appointed, and often those areas, those CABs, advisory boards that cover areas of our committee are often, the representative is often from our committee, although not necessarily so. So we'll have a report if there has been a meeting, but that'll be at the end of the meeting. And you'll notice that it is on every agenda item. It's an item on every single agenda. It's just something that we cover all the time. Okay, so today we have just those two items, and after that, we will close the meeting. Are there any questions? All right, so I just a few minutes ago emailed out a draft of the district needs statement. If all of you could check your emails, we'll give everyone time. Go check your email and open up the document, and we will go over it. Some of you have been on this committee, have seen this document before, and actually some have contributed to it. It is not new. It was something we worked on a long time. We work on every year, and we usually start from something out. We start off with the version that we have in the previous year, the previous fiscal year, which is the previous year, and that is on the website. Susan, did you want to give an introduction to what the district needs statement is exactly?
Sure, particularly since we have 3 new members. First of all, I'm the district manager, which I suspect people know by now. And particularly at the time of district needs and budget priorities, I go to every committee as a technical resource. And so I'd like to first just give a brief summary of the budget process and the district needs statement. The community board is starting their budget process now, but it's for next year. We're looking at a district needs that will be aimed for July 2023. And the district needs is the first step in a process. After the district needs in October, we will vote on budget priorities, which at that time I'll explain more. The district needs statement is a needs assessment that describes our community conditions that give rise to needs. An example might be the number of seniors living in poverty that will then focus on unmet needs. We can recommend general projects or activities to meet the needs. We do not recommend specific funding because that's what happens in the budget priorities. District needs is not a policy document, and it should be documented. And I'd just like to add that I think the district needs statement is really important. A lot of people refer to it. Recently in the site, when Department of Homeless Services cited 2 shelters, in both of the fair share, they cited our district needs statement. Last month, Catholic Charities called me for information because they're doing some planning of affordable housing. And she said our district needs statement is one of the most valuable documents they used. So it's important, it's worth the work put into it. So we should focus, several years ago, our executive committee voted on a specific style that would be direct and succinct and bullet points as much as possible. The reason for this is that we want needs to stand out and not be lost in a wordy document. It should be very targeted and focused so that they stand out. And I think we all have a tendency, and I certainly do, to want to put in a lot of words about things that are priorities. And it's good to afterward then just go in and kind of cut them down to say, what is the need? And do we have a suggested priority? We don't, suggested solution. We don't always have a suggested solution. So that's the main thing. I think the draft that was sent around has various types of comments, and I worked on the homeless section, and I know there's large sections just deleted because I didn't want to remove them without people seeing what was being removed. We certainly don't have to vote on any, we don't have to vote tonight. We shouldn't vote tonight. We will vote on a final document in October with our budget priorities, but we don't have to be concerned at the meeting about specific wording. We need to be concerned about what's going to be in there and what's not going to be in there. and documenting. And Deborah, did you have a question for me?
Actually, it's not a question. I was going to ask if you could lower your camera because all we can see is from here up.
I'm sorry, is that better?
That's okay. Yeah, perfect. Thank you.
So I didn't want you to, I was eating before and you could only see my eyes. So I know this is very abstract until we actually get in it. But if there's no questions, that's what I have.
Yeah, so just so you know, if you've ever looked at the website, there's a district needs statement that's 25 pages, but it covers all of the committees in CB3, not just ours.
Right.
And the other committees work on, they do something with their section and vote on their section. So we have a very large section because there's lots of needs in human services and we have many areas. So we do have a lot of work to do. And as Susan said, it is very important because it is referred to a lot. And we, in this past year, we had to refer to it a lot when we were, even when we're like, taking positions or passing resolutions, we sometimes do refer it to it because in and of itself, the district needs service, district needs statement itself is a kind of like a position statement on, the needs and the conditions of our community. So it's been very helpful to us, and many others looked at it as well. It could be funders, private funders, government funders, maybe even nonprofits looking to, put some information in their own proposals. So it is very important to be, kind of thoughtful and careful and factual when doing it, when writing it. And so it will be edited because it's part of a large document, and it will be edited for uniformity, right, in terms of language. And so we're not wordsmithing today, but just, looking at see if there's, what needs to be included. And just to remember, when Susan said it's for the fiscal year 23, that is the year that begins July 1st, 2023. So it begins a year from now. Although we are talking about now. So it informs the budget priorities that begin a year from now. I know we're not used to that. We're used to something else, but we just have to think that way. So the good way so the positive thing is that we get a head start. Okay, so should we, can everyone just, has everyone looked at it or pulled up the document from their email?
I'm sorry.
Want me to share on my screen?
You want to do it just to share?
Yeah, you can share. Yeah. Larissa, why don't you share, and then others, if it's easier for you, you can just look at your own, document as well. But what Larissa is sharing is what was just emailed to you.
May, do you want to also talk about the process that we had talked about for, because there's so much work that needs to be done that can't be done tonight because it requires a lot of research. For instance, the education section, really pretty much has to totally be re-researched. That we plan to, take, from tonight what's going to be in and, work on it if you and me, and if someone else is involved during the summer, and then it'll come back to the committee in September.
Yeah. So so what you see here is a draft. It is not, on the one hand, not a first draft, and on the other hand, it is not the final thing. And it is because parts of it still need a lot of work, such as education. And the work that is needed, we know what the topics are, what the needs are, but the problem is the documentation of it. And we're not just talking about citywide statistics, but those that are specific to our area, and maybe also some anecdotal stuff, anecdotal information that is specific to our area, which is Community Board 3. And as you know, that covers part of all of school district 1 and part of school district 2. So when we say education, we mean the schools, the public schools. So we don't need to vote on this until the fall. And so we do have some time in August to do that kind of research and fine tuning. So what we're looking at today is not so much the fine tuning, but more the just more like a bigger picture, higher elevated look to make sure we're including everything that we need to research in August. So in August, we'll have a smaller group, just to do that work, and it'll come back to the September meeting. So this committee will not, the community board does not meet in August, I think with the exception of SLA, possibly. But we will meet in September, and this committee will get to review it again with, the new information and research. And I think it's noted here what needs to be totally rewritten, she says, but it's, we just needed to add stuff.
Well, we might add that there were people that were going to be doing the research before this committee, and it just didn't happen. That is the reason it's in the state it's in.
Yes. And there's just been a lot of change in the schools, so. If
I could just speak for a second to the why, we thought it needed to be totally rewritten. The school population has decreased in Community Board 3. We do have the statistics for that. It's decreased dramatically, but along with that, the budgets have been decreased dramatically. When we have schools that, have a lot of needs, we have a number of schools that have 50% or close to 50% kids in temporary housing. So we thought it was particularly important to get information from the superintendent and CEC about the specific needs, and that has yet to happen. I don't think they've even responded to your emails. Is that correct, May?
Yeah, and they're probably just figuring out too, because this drop, is, it's across all schools, and it is not just, it's not just because, in our district, but the drop is from the pandemic, after the pandemic, after shutdown. So, they have these budget cuts, and I think they're still figuring it out too. And so we will talk to them. So we know what the numbers are. That's already, on the website, and, we, have the information, but it's more the actual impact.
Hi. Hello, I'm sorry, I have my hand up, but.
I can't, she's sharing her screen and I can't see anybody's hand up. I'm sorry.
Okay.
Let me, hold on. Yes, Arnett, you have your hand up.
Thank you, Chair. Is it okay? I just wanted to see, I wanted to volunteer to help with the educational part. And in doing that, how does that work out? Do I just get the information and provide it to the chair? How does the research part work once you start to divvy in, or does the committee just work and then wait till September to provide that information from the research?
No, we're not waiting till September, because by September we will be looking at what will be voting on. So we are doing this in the summer, and that's the framework that we have. So the framework is, we do not, she doesn't need to be totally written, but it's, all the stuff is continual. So it's based on something from last year, and then we update for each year. And there are different trends that happen each year. And the last 2 years, it's been COVID-19. So, what you see in front of you is kind of the base that we are working on. But if you have more, I mean, we're going to have a small working group in the summer that's going to meet and just really hammer out this research. So if you, actually, I don't know what your role is in terms of the schools, but, yeah, well, we need people who, have some.
You're former president of the CEC, aren't you?
Yes.
Well, you're not. No, well,
I know who you are.
Well, no. Oh, Naomi is the president, right? She still is, right?
Yeah,
I meant the former one.
I was the president before Naomi.
Between
okay.
Lisa and Naomi, it was Arnett.
Oh, okay. Are you still on the CEC?
Yeah, I just went back onto the CEC as well, but I'm not
Okay.
president. I'm just a member.
Oh, okay. Well, that is helpful. But I think you know what I mean, right?
Yes.
In terms of what we are trying to do.
Yes.
And that is the basis. And we're trying to get at that thing about the especially about the decline in enrollment and the subsequent budget cuts. And our belief is that these budget cuts are no good. I mean, they might just be for 1 year, but that's still no good. So, and will have long lasting impact. So we need some specific information, particularly about the schools in our area. That's what we're trying to talk to Carrie and Naomi about.
Okay.
But does that answer your question?
Yes, I just wanted to know. Well, I wanted to throw my hat in to volunteer to help with that, and I just wanted to know, like, what's the framework in doing that? And you answered it, like doing a working group,
it'll
and
be,
then
it'll be a small group in the summer.
Okay.
Right, so that's the education piece. Covers. Those are.
I have my hand up if I could.
Yes. Okay. So I'm just going to start looking at the hands instead of the document because it's.
Okay, I just wanted, so Arnett, this is the first time we've ever used this kind of format. So I wanted to suggest maybe like a Zoom meeting in a week or so. The reason it has to be less than a quorum working on it, but if we could have maybe a Zoom meeting in a week or so, kind of divide up specifically who's going to get what information. You may be able to get an answer from Carrie or Naomi, but if we can, divide up specifically who's getting what, because the office does a lot of the updates from various sources, but particularly in education, we don't have access to those. So, maybe by the end of the meeting, we'll figure out if that's how we want to format, how to work together.
Cool.
I don't see any other hands up.
No.
Yeah, so that's how we plan to do the whole thing. Shall we just do a run through of the sections?
Is it necessary if it's going to be rewritten?
Well, does anyone have any questions? I don't mean the education sections, I mean the next one.
Oh, I'm sorry.
And anyone can let me know if they want me to put a specific section up on the screen for them.
We just go down in order.
Yeah, we're just gonna go through.
So
Just in terms of the new school, we are having, many, as those of you who have been on the committee a long time, that we have land set aside at Essex Crossing for a new school. However, the school construction authority has not agreed to pay for the construction of the new school. We are, but the land that is set aside has a deadline in terms to be used by. and that's coming up in 2023. So last year, or maybe a year and a half ago, under the former administration, we did have a meeting with HPD, who is in control of the land, and they were very open to this. No, so our strategy has been to extend the reservation on the land, because if we don't have a reservation on the land, there will be no land to build a school. So we did meet with HPD members in maybe a year and a half ago under the old administration, and they were very open-minded to it, and thought, well, there should be a new school, they said. But that is HPD. So we have not followed up since then, and there has been a new administration. So we recently followed up with them, and we think we probably will have a meeting with them in August, right, to follow up on this extension of the land reservation.
Yeah, first week of August.
Yes. So for those of you, I know the current committee members, I know you've been wondering about that for a long time, and that's just an update on that. Okay, so that's the school. I could just scroll down, Marissa, and we're going on to the next thing. Okay, so we have schools, we have youth, and there's just things that we need to update about facility maintenance.
I wonder.
The income requirements, we should check. I think it's still an ongoing problem, because I recently saw Alan Van Capel like the day before yesterday, and he was talking about it like it's still a problem. So let me just, can we confirm? So there's some updating that needs to be down here. We want to add a section about out-of-school youth. So that's youth who are perhaps, undercredited, or they haven't graduated from high school, but they're not in school. And we, no, yes, Susan, are you raising your hand, or is that something?
Yeah, so going back to the facilities, that our providers use facilities in NYCHA buildings that are in terrible need of maintenance. I wondered if maybe any of the members, we're planning to call the providers and ask, but I wonder if any of the members knew of any. I know of 189 L in the senior center there. Is the one I know of. Compost was terrible, but that has funding now. So I was just wondering if anyone else knew specifically of other facilities that were really bad condition. Doesn't sound that way.
We're talking about senior centers?
Any facility, any social service facility in NYCHA, because the reason it's such a problem is because NYCHA doesn't pay for any reconstruction or maintenance needs. And of course, the providers have a very hard time doing it. It's not even their building. So I was just wondering if anyone, Arnett, did you know of some? Oh, she took her hand up.
Hi, this is Carmen here. Sorry, I'm trying to get on with my computer, so I'm using my phone for now. The Metzer houses, that one building is a senior building. They've been without a senior center for years.
Okay.
And I get constant complaints from the seniors there about the lack of services. They used to have at least the Meals on Wheels program, and that stopped completely.
Okay, thank you. That's very good. I know they have funding for their elevators and stuff that's just been sitting there and not used, but I'll inquire specifically about the senior center. Thank you.
I know the Hamilton Madison House recently said they are having problems. So they're in Smith houses.
And what's needed in Smith?
I didn't ask specifically at the time, but
okay.
I need to, I didn't, we were doing something else at the time, but I just remembered that she mentioned it.
Okay, Arnett has.
So we
her-
can follow up with Hamilton Madison.
Uh,
Arnett, is your hand back up?
Yes, it is.
Okay, what did you have to say?
Lillian Wald lost a daycare and Head Start because of the conditions in their building. I
You
can't
know-
remember the number.
Do
It
you
might
know
be
who the
10.
provider- Do you know who the provider is?
The provider was Education Alliance, but they
Okay.
then closed and there hasn't been a new provider since because NYCHA hasn't fixed the conditions. It's consistent leaks and
Okay.
everything that would.
Yeah, I think Ellen told us about that, but thank you. I didn't have it on the list. Thank you. Whoops. No wonder Carmen could get in. We weren't admitting her.
All right, I don't see any hands raised. But you know, Susan, I mean, so it's good to survey the committee members because we all have these connections. But you know, it just sounds to me like we need to do like a, you know, some sort of mass contact of, you know, of all these providers who have, you know,
Absolutely. I just thought
have
that,
something in NYCHA.
I just thought this would be an easy start.
Yeah, no, you're absolutely right. And I'm glad for the info, for the help and information that we're getting right now. Okay, should we move on? Larissa? We're looking at, oh, we're still looking at senior centers.
You went past the pay disparity. And I actually had a question, I think, about what the committee wanted to do with that. You know, it's a human services problem, but the whole problem, I guess, is probably not something we want to put in the district needs, but do you want to have some specific pay disparity issues noted, such as, I know, social workers, that, you know, for providers, I know is an issue. I didn't know how you want to handle the pay disparity, which is a big problem. It turns out there's a whole campaign, Just Pay campaign.
Right, and then some of the, I know some of the settlement houses got funding to, you know, give some cost of living raises. And I don't know if that's just for 1 year, you know, because there's the following year too. So maybe we should get, we can talk to someone at one of the settlement houses or UNH about the Just Pay campaign.
Whatever, yeah, whatever you guys think. I'm sorry, Carmen, I just got to admit, Carmen keeps trying to join and can't join. I don't know what's wrong.
Carmen is here.
It says joining, but I think she's trying to join with her.
With the computer, right? Does the
Oh,
phone?
okay.
It keeps saying joining and never joins you.
No.
All right. So that's what I suggest we do for the Just Pay campaign. You know, does that sound good?
Sounds good. Who's going to do it? Does someone want to volunteer to do it? I mean, we're trying to do as much as we can in the office, but we can't do everything for every committee.
Well, if I mean, I could start with Wayne.
Okay.
I'll start by asking because he was just talking about it the other day. Him
super.
or Carmen or somebody at CPC, because they were just discussing it the other day in another meeting, an unrelated meeting. Okay, so we're done with this, we'll just keep going.
Okay, the senior statistics, the office will do that. I believe we have them all already.
Well, I'll volunteer if you all need anything with the North Sydney Senior Centers. But I do know about Metzer on a personal level. So whatever you need, Susan, let me know.
Okay, sounds good. So Carmen, you're going to find out about the unmet need at the DIFTA at the senior centers in terms of what's highlighted there. Okay, well, we'll see if she gets back.
Yeah, no. Okay, now that I'm fully here. Sorry, I just had to, because the phone was overheating. Yeah, it's really hard to do that with a cell phone. Yeah, sure, I'll definitely take a look at it. And I was just wondering if David's not on the call, is he?
No, he's not, not
All
today.
right, because I definitely would have definitely worked on it with him as well, because we're on the same boat with this.
Which David are you talking about?
Goodness.
David Crane?
No. Or maybe I got the name wrong. Goodness, he also runs a senior center, a NORC.
Are you talking about
Eric?
Eric, I'm sorry, that's it.
So generally, you know, for senior centers in general, like what are they lacking? Is it, you know, is it funding for food? Is it facilities? Is it programming? You know, what's the general need that's not being met?
Well, right now, what we're seeing is the lacking in the programming.
Programming.
Because there's been since COVID, there's been reductions in that.
Is that because of funding or because of staff shortage or what? Or all?
It's a combination. There's been staff shortage. You know, the last meeting I went to at DIFTA, you know, people were clamoring for extra help. So that's one. And two is the lack of funding. We can't afford to pay the people what they're worth, especially social workers that are sorely needed.
So is there a pay disparity issue here too?
I would say so, because you know, what social workers actually get paid and what, you know, if you work at a senior center, what that pay is, the difference is about anywhere between $10,000 and $20,000.
Wow.
Okay. Okay, so we're on to healthcare needs.
Okay, you haven't gotten there yet. For the chronic care management, I haven't seen anywhere documented that this is an unmet need. I mean, it seems like, you know, it's something that's needed in our general healthcare, but it's specifically not an unmet need.
Well, Susan, sitting on the board at Gouverneer, we are trying to expand services, especially for residents there at Gouverneer for diabetic services. Also, there's a high need in the surrounding area for services for diabetic needs. For example, regarding neuropathy, visual problems that arise, and they are trying to provide additional services on the first floor.
Can you bring, they must have documentation then. If you could-
Yes,
if
I
you could
have.
bring- Yeah, if you could bring that, that would be helpful.
Yeah, I'll reach out to Dr. Gagliardi. He could give me the information of what he's trying to do there as far as his expansion.
Yeah,
program.
I mean, it should be for all of CB3, but if it's a problem there, I'm assuming it's a problem in the rest of CB3.
Sure, I'm going to make a note and I'll reach out to Dr. Gagliardi.
All right.
Larissa, maybe when you speak to him, you could just kind of throw in what he sees as the biggest healthcare need also.
Oh, trust me, I will. Yeah, we've had some really great speakers and presentations. I'm sure I can pull from several of our presentations in this past year and get some great statistics.
Yeah, but I mean, even just to ask him, his opinion overall, what he sees as the greatest lack that we have.
Okay, super.
Yeah, especially like this year.
Yeah.
Something different from last year or something new. Okay. Okay, so should we move on?
Give me just a moment to type that up and then I'll move it right on down. Sorry, multitasking. Okay, great. Working on one screen, I feel completely handicapped. I am honestly spoiled. I'm used to working on two screens in my office, and when they,
Okay, so the telehealth stuff, you said,
oh,
we don't need it,
well, they, telehealth.
or telemedicine rather.
Telemedicine, yeah, there was funding provided in the state budget for telehealth.
What about the internet access? Does everyone that needs to use telehealth, do they?
Well, that's still a very big need, and I would continue to focus on that, because in order to join these meetings, you need, high bandwidth.
So maybe we can just take that out as a section, but keep that statement in under the health needs. Would that be good?
Susan, I'm wondering if this whole thing about bandwidth is,
It's
only in human services, or is it something that belongs in the beginning, in front, before, not in any particular section?
That if you think that's a good idea, we could include it in the intro. We do have very specific statistics for that in Community Board 3, and we do have an unmet need in Community Board 3. So we could certainly add that to the general intro to this whole statement. But it looks like, if we maybe just keep one sentence here, because it looks like that we do have the updated stats. We still have 20% of households that are lacking this.
Yeah. Oh yeah, we could do that. And then if we still really want to talk about telemedicine here, we could just refer it to the other statement, which is in the beginning.
Okay.
I don't know if others want, other committees or other areas need to refer to it as well. Maybe they do.
It's not, I don't know yet, but so far it's not in any of the other, parks asks for, Wi-Fi, but other than that, it's not in any other section. But like I said, we can put it in the intro. It is, I think it's a good idea.
Okay.
What about an educational need?
We don't.
Well, yeah, it is an educational need.
Yeah, it's an educational need, because they're trying to, I know there was talk about no more snow days that kids would be meeting remote. So,
We'll get that from CEC.
yeah. So it should be a general need, unmet need.
Okay. We can move on if there's nothing else. The skilled nursing and rehab facilities.
I had my comment at the bottom of that.
Okay. So do we need to?
Well, do we need to just have people aren't saying much. I mean, and I don't know, this is not an area I know, but it's maybe, it looks like maybe we still need nursing home beds and Alzheimer beds. Does that sound right? And is there maybe someone we can check that with? Maybe even Ricky Wong, a former member?
But he's not in the area anymore, right? Or
No, he's still here. He's just,
yeah, I mean, he's not in health anymore.
he's not in health anymore, but
How
we could even ask him for a direction of who to, go to.
maybe that would be good because once they're out of it, I mean, it's very fast. Just get out of date. Is your contact, Pauline Ferrante? Is she?
Yeah, but the city's not going to tell us. They don't want nursing home beds. The city and state do not want nursing home beds. They
Okay.
want people to be at home. And, as you've said many times yourself, it's the providers, the nonprofits are the ones that are willing to say what's needed.
Okay. Okay, yeah, we can ask. We can find out who is a good person to ask. But yeah, I mean, nothing has changed that we don't have any new nursing home beds.
No, I think that the big push now is to, do hospice and in-home care and using home health aides and home attendants.
Yeah,
That's the big push right now.
But for the Alzheimer's, I mean, it's a specialty,
those are-
Right.
that those can't take care of. Don't you think so, Carmen?
Well, I mean, I can always contact the Alzheimer's Association and see what the trend is.
That would be great.
Yeah, okay. All right. Okay, unintentional drug overdose. Yes, it is.
It's gotten worse. We have one of our parks is now the destination area in New York City for K2, both dealing, for dealing. There's a lot more.
Yeah. And I think even amongst those who have housing, I think it, I mean,
Well, I'm not just talking about homeless. I'm not just talking about homeless. I'm talking about dealing.
Okay. But there's so much mental health, crises going on that it's happening to everyone. So I can see how this is a problem for everyone, not just the dealing. And I mean, the dealing is what it's a manifestation of the problem.
Yeah,
I'm talking about an overall thing.
I was just talking, it's a big deal. I mean, it's very prevalent. That's all.
Mm-hmm. Yeah, I don't want it to also have the in here just in context of the dealing because it's the dealing makes it worse, right? I mean, but it's there's dealing because there's something else going on.
Correct. I was just shocked that the main place in New York City was here.
Okay. Oh, okay. I didn't know that. have food security.
Again, what is the unmet need?
Okay, so let's just update it to see if
Sorry,
it's
I raised-
gotten worse.
I'm sorry, I raised my hand. Hey, Susan, can I
Okay,
ask you
go
a
ahead.
question
Sure,
about what you just said?
sure.
So I just want to make sure I understood. So of all the parks,
Your park.
yeah, my park, my personal park, is the not like where, when you say number one destination, is that according to police, according to?
I'm trying to remember. It was actually quoted. It's even been in the newspapers. I can Google it and find it. And I should for this thing, but it's been even in the media. It seems it's become well known that Sarah Dillon at Roosevelt Park is a destination park for K2. And the police have constantly told us, yes, about arresting dealers there.
Mhm. Wow. Okay, thanks.
So I
So-
think for food security. Oh, Deborah. Oh, I guess you just have not put down your hand yet, right? Okay. Food security. I think it just needs to be updated. I mean, we have something from 2019. And, food pantries are still as busy as ever and even busier. And so,
If people need,
maybe we compare it to last year or something like that. Is it worse? Is it, and that's what we need to do.
if people need to go to food pantries, there's a bigger unmet need. Why are they having to go to food pantries?
Okay.
And I don't know the answer.
All right. So, Eric is not here. We can ask Eric. He has a lot of information in his head. I'm just getting it out of his head and onto this piece of paper.
Okay.
And, he doesn't need to go research because it's all in there. So I'll follow up with him. And if I can't get hold of him, there's another organization that also has a pretty busy food pantry. And they serve Chinatown on the Lower East Side. And I can also ask them,
Right.
what's different this year? Why are people still going to food pantries? Because at first we thought it was just the pandemic, but it's been 2 years. Anything else on this? If not, we'll move on. Okay, the homeless population.
So the very first part is just updated information from this year's HOPE report. And from Coalition for the Homeless.
Okay. And then the second part, because you had worked on this, right, Susan?
Pardon?
You had worked on this, so you added a new
So
section
the
about families.
The families in shelter, I took most of that from the panel, their slides. So that's where it came from. And then most of our statistics that we use to update things are from the Furman neighborhood report. This yellow section still needs to be rewritten or researched or reworded. It's probably a lot of words that are actually just duplicates of what's been there before.
But I think it's important to note, and all of you probably know, that families and children make up the vast majority of population in shelters, and all of you know, I'm sure, that many of them are actually the working poor.
It's
our
all in there.
stereotype is often, that, oh, they don't have jobs and they need to get work, but actually that's not true. They are actually working.
Yeah, I think I included all that in the part from the panel.
Okay.
There's no more homeless in the subways.
They're now in the parks.
I don't know I really don't know. I guess it needs updating. I mean, it's still, people are still living in those parks. Do you think it's important to keep that in? It seemed a little lame to me, but I didn't know what to do with it.
Hey, Deborah, do you have an idea? Since your park is mentioned. Deborah Glass.
Yeah, I hear you.
Or should it be more like in the category of the street homeless? Because there's another section on street homeless.
It's all mixed up and all intertwined. I mean, it's hard to say. Yeah. Do I have any ideas about this? No. I mean, I'm happy to do some conversating with the folks who are out here doing their thing, but yeah.
I think maybe what May said is a good idea, to just include that in street homeless, because they are street homeless who are in the parks during the day.
So they sort of move around a little bit too, right?
Mostly, they're mostly, not 100%, but mostly.
Okay. The other idea, Susan, you had was, and it just came back to me because Deborah said something about talking to people doing their thing. But there's a little project, or was it?
The pop-up in SDR?
Yeah, the pop-up is at
Yeah, maybe we should.
highlighting somewhere.
Is-
Sometimes we do
yes.
these little highlights.
Yes, I just haven't had time to go, but I will try next week. So just to let everybody know, a couple of months ago, Bowery Mission and City Relief, I think it is, contacted the office, or the CB3, and May and myself, for help on where they can help give out food, to homeless and other people who are hungry. They used to do it at Tompkins Square Park years ago. It had to shut down, and Tompkins Square Park is actually saturated with food providers now. So we suggested SDR. We got parks involved. We got the Park Coalition involved, Manhattan Outreach Consortium, and there's now a pop-up at a center every Thursday where people give away food. They try and get people services as far as beds, getting them on case management. Sometimes there are people that come with food pantry items or other miscellaneous things like socks. And it's really wonderful. It's just absolutely wonderful. And I keep wanting to go down, and it's on Thursdays, and I'll try next Thursday to maybe take some pictures, and maybe we can do, sometimes we have a little sidebar to personalize things in the district needs statement. Maybe we can do something about that, because it's a wonderful model. Maybe people will look at that and want to do it other places.
Yeah, and I saw, her name is Teresa, I think. I saw her at an event. I mean, it wasn't on Thursday. It was a weekend event at the at Sarah Day Roosevelt Park. So she mentioned it. But she also said they don't strictly serve. They serve anyone who needs it. So it is not just the street homeless. It could be some little old Chinese lady, or those old Chinese senior citizens who are really poor and just need stuff. And so it's sort of
Great. Yeah.
Okay. Yeah, it was just
Good.
paused, so I'm not sure why. We didn't get kicked out, which is good.
Yeah.
The other thing is that today, I mean, I would say from the time that I was there, I spent a little bit of time out there. I would say of the folks who were there, I would say 50% were elderly Asians in line. So it's being utilized by the entire portion of the community. And I know that there was some tension.
Really?
Yeah, well, at the beginning, I think the unhoused kind of were feeling very proprietary about receiving the help until it became, sort of clear that this is for anyone who needs it. So that's something that kind of came up at the very beginning. I don't know. I think that that's been smooth. Excuse me. I think that that's kind of been less of an issue, but I know that there was an undercurrent, particularly when we were talking about the ideas when the question of the shelters were coming up. So that was, anyway, that's not anything to do with this, just some added
That's
context.
that's interesting. I did not know that. But yes, when Bowery Mission approached us, it was to give out food to people who needed it. We brought in Goddard because we thought it would be a good place for them to offer services. Also now Housing Works is also participating for harm reduction. And we hope eventually to have mental health field resources there also.
Do you want to, I mean, I there are a lot of like really small organizations that are trying to do something in the park. I don't know whether we want to include things like the smaller organization that comes and gives out backpacks that has food and socks and all that, or no?
What I would do, if you would email me who they are, let's leave it to the people, the Bowery Mission and Goddard, to know whether they can keep it organized. Let's let them decide.
I'm just saying they do it on their own. They're not trying to come on the same day that those.
Maybe it would be a good thing. I don't know. Let's suggest it.
Yeah, there are these different tensions, but if they can sort of manage it and, keep it together, I think it's a good model, because we do have a lot of tension in our community. Okay, should we move on?
I think that's the bottom of the document.
Oh, okay.
So I think we managed to get through everything.
All right, are there any questions or other?
Is there any other ideas people have?
Anyone with more writing or research skills want to help us in August?
I can send the stuff I know about internet connectivity, because that's an issue I've written about before.
Super.
Okay. Yeah, that would be good. Larry, right?
Yeah.
Okay. Okay, that would be wonderful. Deborah, your hand is still up. Did you? No? Okay.
No, it's just gotten really bad at Zoom.
We'll be in person one day soon.
You've had enough practice, Deb. Come on. Well,
all right. Okay, so if
I may, I'd like to volunteer also. Something that we're really trying to push is funding for an urgent care at Gouverneer. We feel that we really need an urgent care that takes people on a sliding scale, that will accept Medicaid plans.
That's a budget priority.
And I
And
thought if we put it in the district need, it might highlight it and benefit toward a budget priority.
we can make it a budget priority, but
Super.
we're putting together agendas right now for the consults with the agencies. So if you would like explain the need, and I will put it on the Department of Health agenda for the budget consults.
Okay, bear with me. Let me just make a note for myself.
And maybe you can find out if, the city is looking at funding at this, what the status is.
Well, we are looking at it. We're basically.
No, this, I'm talking about like management.
Oh, yeah, I've reached out to several elected officials regarding the need.
I'm talking about management and budget.
Okay,
Has this been what I'm trying to ask? I'm
yeah,
sorry, I'm not being clear.
well,
Has this been
so-
presented to the city and have they said there's not enough funding?
yeah, they are basically short the $5 million operating
Okay.
expenses for 5 years. We have everything else budgeted except that, and without that, we can't move forward. So
Okay,
that's
so-
what we're trying to close the gap on.
If you would put all that, in, we'll make it a
Sure.
very specific question for Department of Health.
Thank you.
All right. Okay, so we have nothing else. Is there anything else we need to talk about on this? Susan?
Not that I'm aware of.
Or, okay,
Still a lot of work to be done.
there is. All right, so let's move on to the next agenda item in that case then, which is CAB reports and CEC reports. Okay, CABs, Community Advisory Boards. Were there any CAB meetings for any of the hospitals? Gouverneer?
Yes,
I
we did have, sorry, this is Larissa. We did have our final meeting for the spring where we will not be meeting July and August. We were supposed to hold elections for new officers. That was postponed due to a lack of quorum. We wanted to make sure everyone had the opportunity to run for the office. I have been nominated for chair.
Wow.
Yes.
Oh,
Oh, very exciting. I had a terrific group that I worked with in our executive committee. We got a lot of things accomplished, and we're really looking forward to closing the other needs that have been a priority for Gouverneer for some time now.
okay, excellent. All right, I see Laura is here. Laura, are you, how's it going with the Bellevue CAB?
I
Are
did
you on it
Bellevue.
yet?
I did Bellevue and I did Lower Presbyterian.
Okay,
Both will not be meeting over the summer. Lower Presbyterian is hosting focus groups. They are doing their community needs assessment, and they are going to be setting up stations throughout Lower Manhattan to ask the community their needs in the health system. Bellevue is in the process of doing chair nominations, but that was postponed for over the summer.
okay. All right, so are you the taking over for Ricky in terms of the Lower Manhattan Presbyterian?
Correct.
Yes or no? I'm sorry.
Yes.
Okay, and then you're also going,
I'm sorry, is that yes or no?
Based on the email I received, it's yes.
Okay, I'm sorry, I wasn't clear. So you were appointed to represent CB3, because I need to update the website and all that, and I never got notice from Paul to do that.
I'm not sure who you were supposed to get notice from, but I will just forward you the email that asked me to join and to be a part of the Lower Presbyterian CAB.
That's okay, but Paul asked you to represent Community Board 3.
Correct.
Okay, yeah, somehow I think we missed that. So if you will do that, I'll have the website updated tomorrow. Thank you for doing 2.
Thank you, Susan.
Took like 6 months at least to get you on the Bellevue one.
have any of the shelters met the CABs?
They haven't, not all. The Catherine Street is not back at Catherine Street yet. It's kind of funny because people are complaining about it, but they haven't been there for over 2 years. They're still doing reconstruction. And 3rd Street is back. But they haven't had any meetings, but I will report the drug dealing outside for the first time in like 10 years. seems to have abated. You know, it stopped during the pandemic, and the people that deal drugs are still around, but they're not dealing drugs. So I don't know. I'm not questioning it, but it's kind of amazing after all these years.
Okay. All right. Okay. And I know we haven't been to CEC meetings in a while. After Tati left, we, just haven't been able to go regularly. And we need a regular rep again. I know Laura was originally, but they would meet the same time as our executive committee meeting, the exact same time. And so often, well, Laura's not on the exec committee anymore, right, Laura?
No, so I'd be willing to go to the CEC meeting.
Okay. So I think they're having a meeting like next Thursday. Well, yeah, I got an email for it. So it'll be useful to us. It'll be helpful if you go again.
All right. May, if you could just send me the dates, please.
Okay.
Thank you.
So you'll be able to do that on top of the cabs? It's a lot of meetings.
The cabs don't meet monthly.
Oh, okay. All right, if you're able to, that's fine. If not, we can, we have a lot of committee members here, so we can divide up. And then also, Arnett, you're an officer in the CEC currently, right? The CEC 1?
Yes.
Oh, okay.
Yes.
So that can provide.
Oh, so Arnett, you can bring back the information.
Absolutely.
Oh. Right, so maybe, are we saying that maybe Arnett should be the rep instead of Laura? Does that sound, Laura, would that work better for you? I'd be, okay, here she has her thumbs up. Right, so I need to just communicate with Paul, right?
Send an email to the office and ask us to, copy Paul and ask us to, what you're saying, Arnett's going to represent. Yeah, just ask us to, to update that.
Yeah, because she's an officer and she goes to the meetings anyway. She's an officer of the CEC 1, right? And she goes there anyway, so.
Are you an officer now or a member?
Yeah, I said member because it's I'm the second VP, but we're going to redo our bylaws, and that may not be the case in July. So I'm actually our next meeting we'll decide if we'll still have a second VP, and then I have to run for it. So that's why I said a member.
Okay, so it's just important for us to have a specific reps, if nothing else, out of respect that for the CEC.
Absolutely.
And your term of membership is for another year at the CEC?
Correct. It's for another year. We just have July would just be our meeting would be voting for the executive board for the next term. Their terms are for 2 years.
Oh, the CEC terms are 2 years, but the exec board is less. Okay.
Mm-hmm.
All right. Okay. Thank you. Yeah, so I think we're at the end of our meeting. Is there any old business or new business? Okay, I think also just for the, particularly for the new members. So as I said before, we're not meeting in August. We will meet again in September. Also, we are having a full board meeting in July. It will be on Monday instead of, it's usually on a Tuesday, but this time it's on a Monday and it will be on Zoom. So it's the last Monday in July. This is the last Monday. It's, I think it's July. I'm sorry, I forgot the date, but it's on the website. So it's July 20. I forgot the date.
5th.
25.
July 20. Okay, July 25, and it will be on Zoom.
I could just add on that line that this committee is usually the first Thursday of the month.
And in a month when there are many holidays, such as, December, for example, many meetings get switched around from their regular date, to accommodate the holiday time. But September should be a regular month, I think, unless there are many Jewish holidays. I'm not sure. And then in terms of agenda items for meetings, usually by the time of the meeting, about 2-3 weeks before the meeting, the agenda is already set. Sometimes we get agenda items because of requests from, different organizations, or, they have something they want us to, to look at or review, or maybe they have something they want us to support. Maybe they're looking for funding, who knows? And then so for committee members, if you have you may wonder, like, now that you're on the committee, you have an agenda item, and how do you get onto it? So you can always send me an email. Earlier is better than later. Don't send me email the day before that you want to have an agenda item the next day, because it's not going to happen. But and then we can talk. So I'm not making any promises, and I'm saying that your agenda item will be at the next meeting. Maybe it needs to be, reframed, or maybe it's not appropriate, or maybe it's for another committee, or maybe it's just for an update for information. I don't know. So, but the first thing you do is you can contact me and we can talk. So don't be afraid to do so. Okay, any other questions or things to talk about? Okay, if not, then we can have the final roll call.
Okay, Meg, give me just a moment to get the document up.
Oh, also don't forget the party on Sunday.
Oh yeah, Sunday, the party of 4 to 6.
Yeah, 4 to 6. So please come.
Yes,
Old
everybody.
members, new members.
Yes.
In person. Ooh, 3D. Okay, final roll call.
Yes.
Maylee.
Here.
Thomas Rose is absent. Larissa Shainberg present. Ana Calderon.
Here.
David Crane absent. Eric Diaz absent. Larry Fenn.
Here.
Shirley Fennessy absent. Deborah Glass.
Here.
And Alicia Lewis Coleman.
Yes.
Laura Lugo.
Here.
Heidi Schmidt.
Here.
Arnett Scott.
Here.
And Carmen Perez.
Present.
Great. Thank you, everyone.
Thank you. Okay. See you at the party.